Okay, so we were assigned the urinary system. The urinary system consists of the kidneys, the ureters, the bladder, and the urethra. And the function of the urinary system is to remove liquid waste from the blood in the form of urine.
The function of kidneys is to filter blood. Each nephron filters a small amount of blood. The nephron includes a filter called the glomerulus and a tubule. The nephrons work through a two-step process. The glomerulus lets fluid and waste products pass through it. However, it prevents blood cells and large molecules, mostly proteins, from passing.
The ureters are tubes that carry urine from the kidney to the urinary bladder. There are two ureters, one attached to each kidney. The upper half of the ureter is located in the abdomen and the other half in the pelvic region.
The urinary bladder is a muscular sac in the pelvis just above and behind the pubic bone. When empty, the bladder is about the size and shape of a pear. Urine is made in the kidneys and travels down two tubes called ureters to the bladder. The bladder stores urine, allowing urination to be infrequent and involuntary.
The urethra is the tube that carries urine from the bladder to the outside of the bladder.
Bladder cancer. Bladder cancer is a form of cancer that affects the lining of the urinary bladder. Mostly affects older adults and can be treated if found early. The most common side of bladder cancer is blood in the urine. Treatments include biological therapy, chemotherapy, and surgery. Bladder cancer can be diagnosed by performing a urine test, biopsy, and cystoscopy. The staging of bladder cancer can be determined by CT, MRI, PET-CT, and ultrasound.
Okay. Some of the signs and symptoms of bladder cancer can be blood or blood clots in the urine, which is the most common. Other signs are burning during urination, trouble urinating, and frequent urination. Symptoms of advanced bladder cancer include being unable to urinate, lower back pain on one side, loss of appetite and weight loss, tired or weak feeling, and swelling in the feet, also bone pain.
The causes of bladder cancer. Researchers have yet to discover the cause of bladder cancer, but they do believe that DNA and inherited genes play a big role. If a close family member has been diagnosed with bladder cancer, that puts yourself at high risk as well.
Some of the risk factors can be smoking, occupation. If you're a truck driver, textile worker, work in chemical industries, leather industries, a hairdresser, metal workers, printers, rubber industries, or a painter. Your age plays a big role in contributing to bladder cancer. So the older you are, the more likely you are to have bladder cancer. Men are more likely to be diagnosed with bladder cancer, and so are Caucasians, and if you have a history of bladder cancer.
Some more risk factors. It could be inherited throughout your genes. Certain cancer drugs and pelvic radiation may increase the risk of bladder cancer in the future. Low fluid consumption and your diet. A diet high in fat and nitrates could be a risk factor for bladder cancer.
Okay, so here's a chart showing the survival rate of bladder cancer. So the older you get, the less likely you are to survive bladder cancer. Compared to if you're age 15 to 49, it's right above 70% survival rate, compared to age 80 to 99, which is right above 40% of survival rate.
The yellow areas around the lining of the urinary bladder, such as where the red arrow is, are all areas of cancerous bladder.
This is a CT urogram with contrast identifying bladder cancer. These black dots are cancer.
Image 1 is an ultrasound identifying bladder cancer, and image 2 is an X-ray identifying bladder cancer.
So here's our model. This is the urinary system. Here's the right kidney, right ureter, left kidney, left ureter. the bladder and the urethra. And these yellow spots in the bladder are cancer. Okay. That's it.